Hello, I'm Zoe from the Duck Theatre Company. Since 2007, we have been making issue-based theatre, film and music to raise awareness about the lives of people with learning disabilities and autistic people. We got involved with LeDeR at work because we know that people with learning disabilities and autistic people often won't get good care and treatment. I know from my own experience. When I was in hospital a few years ago, I was very ill and had tubes in me. I couldn't talk. When my mum was not there, I felt dead lonely. The nurses did not know how to communicate with me. They just presumed I could not read, draw or write. It made me feel lonely. My mum had to teach them how to communicate with me. When they did, it made me feel whole of bear and included. The Twisting Ducks have made 3 films that we're going to show you today. The first film is called 24 Years Worth Living. Cue the film.
What shall we do today? 2 ticks, we'll be on our way. 4 reasons why to stay. What's in a number? Looking back to yesterday. Making plans and making hay. All our dreams along the way. What's in a number? Loving life. This is our time. Holding on to 24 years worth living. I'm proud of who I grew to be, of all the possibilities. I've been a star upon the screen. Did you see me? I wrote a book for you to read. I met the girl of my dreams. I found the friends I truly need. Can you see me? Loving life. This is our time. Holding on to 24 years worth living. 24 years, that's 1,248 weeks, or 288 months. That's 8,760 days. Well, I've sailed the seas, felt the ocean breeze, found a world out there that changed me. Made a family, built a home for 3, felt a love so big it shaved me. Look at you and me, we can live our dreams, making memories together, and you'll see we've got a lot to give. What did you do today? Did you while the time away? 24 hours in a day. What's in a number?
So today I wanted to talk to you about a piece of work that we've been doing in North Cumbria. LeDeR reviews had taken place locally, and they highlighted a lack of use of the Health Action Plan for people with a learning disability. I'm sure that you're all aware that all people aged 14 and over who have a learning disability are entitled to have an annual health check in their GP practice. And I'm sure that you're also aware that the quality of the annual health check varies greatly, from some people receiving a phone call from their practice nurse to some people receiving a 1-hour face-to-face appointment with their GP or nurse. A good quality annual health check should result in every patient receiving a health action plan. But it's not just about increasing the numbers, it's also about a good quality and meaningful plan. They help to reduce health inequalities and keep the patient safe. It summarises what was discussed in the annual health check and any other relevant information from the patient record. We undertook a project to improve the quality of the health action plan for people with a learning disability and to increase the input in terms of making it more holistic and visual for patients, more user-friendly and easier for clinicians to complete. We reviewed the current health action plan in EMIS, which is the GP electronic system. The current EMIS plan lacked essential information and was neither user or patient friendly. The project was co-produced, taking into consideration the voice of the patient, carers and their families, and the clinical aspect of the project was taken into account by including primary care in the pilot process. Protocols were written so important information automatically merges into the health action plan from the annual health check template. This is all written in easy read format. This information includes various things, including personal details such as name and address, etc. It also details other things like allergies, reasonable adjustments required by the patient, and lots of other important information, including current medication, weight, diet, exercise, mobility, smoking, alcohol, substance misuse, sexual activity, blood pressure, details about eyesight, hearing, teeth, and health and cancer screening, along with flu and COVID vaccinations. At the bottom of the plan, there is a section about the patient's own health goals, their targets, and what they plan to achieve throughout the year. At the end of their annual health check consultation, the clinician is automatically prompted to tick a box. This automatically produces the health action plan. This is then printed and given to the patient. The patient then has this plan as a reminder to help them through the year, to remind them of the things that they are planning to achieve in relation to improving their own health. If they wish, the patient can share this plan with family, carers and other health professionals to support them to achieve their health goals and wishes. Actually making the next step for clinicians in providing a good quality health action plan could make that difference in improving patient outcomes, to make the work of prevention really real for someone. Someone who doesn't have a health action plan may actually die 24 years younger than they should have done. But with this intervention, it hopefully will help to decrease the potential early years lost for that person.
Continuing the theme of prevention, so how can we help people stay well, I'm going to just take a few minutes to talk about what we've been doing across the North East North Cumbria to improve the uptake and get access to having your flu jab, having flu immunisation. We know that people with a learning disability are more likely to get seriously poorly from flu than everybody else. We know that children and young people and adults with learning disability are entitled to a free flu vaccine. We also know that LeDeR told us in the annual report last year that 17% of avoidable deaths were due to respiratory conditions. The flu vaccination could be the single thing that prevents that from happening. So it's really important that everybody is vaccinated against flu. So we've developed some new resources this year and a range of initiatives and given out some really robust communications to GP practices, to adult social care, to schools where children and young people with learning disability go, to try and continue to improve access to flu immunisation. So just to give you a little sense of what we've been doing for children and young people in particular. So we've been working very closely with the SEND team and particularly the SEND school flu immunisation team. So in special schools where children with learning disability and young people go, a lot of children with learning disability and young people go, they've been able to be immunised against flu in school. But we know that there are still quite a number of children, even though the nurse comes into school to immunise them, there's still a number of children that are not being immunised. This year we've made some stuff, because everybody loves to have stuff. So to incentivise the children, to try and encourage them to have their flu vaccine, we've got water bottles, stickers, notepads, that the nurses have been able to take into schools, and when the children have had their flu immunisation, they can have stuff. We've also given lots of information for the schools to put in their school bulletin. We've had a short film made for family carers, and we also got a short film that's specifically aimed at the children themselves, again showing really simply why it's really important that they take their flu immunisation. So all of those films can be found on the Learning Disability Matters for Families website. So what have we been doing for adults across the North East and North Cumbria to improve the uptake of flu? Well, this year we've worked with three distinct groups of people. One has been in primary care. So we've been working with our learning disability primary care facilitators to support those GP practices. So across the North East and North Cumbria, there will be a learning disability primary care facilitator, a nurse, that is assigned to every GP practice, and they have been working with the GPs to increase the uptake, to support the GPs, make sure that people are invited for their flu immunisation, that if they need to help the GP make reasonable adjustments for the person, that they've been able to do all of that kind of work. What we've done is we've made a great big primary care resource pack, so in there's loads of resources to help GPs. We've done something very similar for social care. I mean, social care is massive, much bigger than GP practices even. So again, we've made information and resources specifically to support social care staff, so the social care workforce and the people that they support. And we've also made some training, some workforce education, particularly for social care providers. Again, spelling it out to them why it's really important that people are vaccinated against flu. Protect yourself, but also protect the people that we support as well. And hopefully we will see that inequality gap of the numbers of deaths because of respiratory illness come down, because more people are protected against flu.
So I think that just to say that we really kind of promote hospital and health passports when our patients come into the hospital. They're such an important resource, and they contain really vital information for staff, medical staff, nursing staff within the hospital. Just in case there is some communication issues, if the person's too unwell that they can't sort, if they haven't got any supports, so these passports work really well, but they alert professionals about really vital information, promote communication within the hospital, and also try and reduce the anxiety about sharing information.
Because I'm sure if anybody's been in a hospital and having to repeat yourself when you're unwell about what's been going on, or kind of things that you like and you don't like, if you're not feeling well anyway, then that can be really stressful and trying to explain things. So the healthcare passport is an aid to allow people to know really important information about people in a time that they might not necessarily be able to share that. Obviously it's really important that those are up to date, so why the healthcare passports work is to let people know what they like and they don't like, so that we think that's really, really important. And it might just be really discrete things like I really encourage people to put in healthcare passports things they like watching on the TV, things that they like to eat or they don't like to eat, because obviously if you're in hospital and someone's offering you a meal that you know you're absolutely not going to like, then that's no good to you. Or if you're a vegetarian, it's really important that those really discrete things. And I think it also allows people to build up a rapport with people in hospital as well. So I find it great when I know that somebody likes Coronation Street, because I know that I can talk about things that I like and they like. But it's just really important to have that little bit of a starting point to be able to build up that really important rapport when somebody's coming into hospital. It's about improving experiences within the healthcare system as well. Obviously it's really stressful to come into hospital. It can be for anybody who's got a learning disability or autism, or if you don't. So it's really important that the experience is as positive as we can make it, and that's why we wanted to include as much information in the healthcare passport to allow that to happen. It gives professionals contact details for really important information in people's lives. So that could be next of kin, that could be family or carers, but equally it could be, you know, community learning disability nurses who are involved. And, you know, day to day that person might be able to tell people those contact details, but if you're unwell and you're in hospital for a reason, then there might be a reason why you can't share that. So that's really important to have that information there as well.
The passports are available on the Trust intranet and available for all staff to access. This can be either printed off or you can use it as an electronic version. The Diamond Standards training is being rolled out throughout the Trust. We do face-to-face training with all of our colleagues within the hospital, and also do the training is now on the electronic ASR system. It is mandated training, so it's every 3 years, and we do, as a network, we kind of update that regularly, so we make lots of, update it and make lots of changes to that. And we would always encourage staff within the Trust to offer an additional passport, so if a patient came in and they didn't have one, to offer that patient one, to perhaps get their family, their friends, their carers to assist with that, so that we know that we've got the information if they were to come back into hospital. But also we work really closely with our community learning disability nurses who have access to providers who also take a little bit of responsibility for updating the passports as well.
I think it's important to remember that it is, you know, a choice of the person if they would like a healthcare passport, because not everybody would like one. But I think to discuss the benefits that we've talked about today, so it's important that they are completed by the people who know them best. Encourage that they are up to date. That's really, really important, because the last thing we would want is for things to be followed that aren't correct. Medicines as well. Obviously as well, people's likes and dislikes change, so that's important as well. To remember.
Welcome to Be Cancer Aware. We are people with a learning disability and autistic people. We are from a self-advocacy organisation from across the northeastern Cumbria.
Together with the North East and Cumbria Learning Disability Network and the Northern Cancer Alliance, we have co-produced and now delivered the Be Cancer Aware course to the learning disability community.
To start our presentation, we want to share a short film just made before the pandemic. This will introduce you to some of the team and the Be Cancer Aware projects.
How can we make a difference to reduce the years of life lost to people with learning disabilities and autistic people?
Health and care passports need to be more widely used and accessed, and widen the scope so they can be accessed in various formats.
Education and training around learning disability and autism is needed for health and care professionals. Continuity of carer to help people build relationships, and for professionals to know the person they care for really well.
Videos of how to do the self-directed cancer screening test. Training on diagnostic overshadowing and the implications this can have.
We need to identify more people with a learning disability and/or autism in GP registers. More learning disability nurses.
We need to better communicate across services and departments if a person requires reasonable adjustments. Listen to families, carers, advocates, supporters.
Think outside the box for preventative measures for flu immunisations, e.g. going to day centres, residential settings, etc. Better links with education to support CYP and families. Smarter contracting and commissioning. Preparation and proactiveness is key. Support people before crisis.